Thank you. Now on Bounce, November is National Diabetes Awareness Month, and with us today to discuss this chronic disease is a Minute Clinic nurse practitioner, Vera Rivera. Nice to have you with us tonight.
Thank you for having me.
Absolutely. First, let's talk about the services that you guys offer at Minute Clinic.
Well, at Minute Clinic, we offer blood sugar checks. Also, if you have a sore throat, possible urinary tract infection, ear infection, problems with allergies, need your flu shot or catch up on immunizations, we offer a broad range of services inside CVS's in North and South Carolina.
Okay. Let's switch over and talk about diabetes, a big reason why you're here tonight. For those who don't know, what is diabetes and how does it develop?
Diabetes is a condition that develops with high blood glucose. Glucose, which is really just a sugar, is the main source of energy for our body's cells. Insulin is a hormone that we produce that allows the glucose to enter these cells. When we don't produce enough glucose, or our bodies don't respond normally to glucose, that's when our blood sugars rise and we get the condition.
How prevalent is diabetes?
Unfortunately, it's very prevalent. 30 million individuals in the U.S. currently have diabetes.
And that's the diagnosed number, yes?
Yes, ma'am. Yes, ma'am. And then there's another 84 million that are pre-diabetes, which means they have elevated blood sugars, which lead to the condition.
And why can diabetes be so serious?
Now, diabetes can be managed, but if left unchecked, or you don't know you have it, it could lead to heart disease, kidney failure, eye damage leading to blindness, and another common complication are sores and nerve damage on the feet.
And then it could, in some cases, can lead to an amputation in the worst case scenario.
Yeah, in the worst case scenario, absolutely.
Who is more likely to get diabetes?
Well, if you're obese, obesity is your biggest risk factor. However, there's also a genetic component. For instance, if you have a family history or a family member with diabetes, then you're at greater risk for this condition.
Let's talk about some of the signs for the folks at home who, may not or may be concerned.
Right. Excessive fatigue, excessive urination, extreme thirst, increased appetite, but yet unexplained weight loss, those are all potential risk factors or indicators.
How do you monitor your blood sugar levels?
You monitor it with a simple blood test done by a medical health professional, and this is a service that we offer in Minute Clinic inside some CVS's in both North and South Carolina.
Okay. And who should have their blood sugar levels tested and how often?
Well, when you're healthy, you should have this done every couple years, particularly as we get older. If you have one of the risk factors that I described, like a family history, a family member, then you should really get it done once a year. And if you're having any symptoms that I suggested, like unexplained weight loss, excessive fatigue, then I recommend you get in as soon as possible.
Okay. All right, Vera is going to do a check on me. I volunteered.
Yes.
So let's talk about where we begin.
Yeah, I'm going to do an A1C check on you,
Okay.
which is a blood sugar check of your average blood sugars over the past 2 to 3 months. And this is a great check to get because you don't have to be fasting.
That's good.
Yeah, so you could come in, you don't have to worry about being hungry. And I'm just going to clean off a finger.
Okay. Not a big fan of getting pricked or needles, so
no,
this should be
and I
fine.
don't blame you. We're just going to do a quick, sorry.
That's all right.
You all right?
Thought it was going to be worse. I'm such a scaredy cat. I totally own that.
We're just going to get some more blood here, and it's just a little bit.
So if you are diagnosed with prediabetes or diabetes, how is it treated?
Well, at first, your doctor will just simply try to manage your, your diet and increase your exercise.
Okay.
But if your blood sugar numbers are still too high, that's when you would need to be on some oral medication or possibly insulin injections.
Okay, okay. But it can, hopefully, you were saying a lot of people, it can be managed.
Oh, yes, definitely. A lot of people can be managed with just exercise, increased exercise, and diet.
And, of course, that means backing off the sugars, the simple carbs.
Absolutely.
Okay.
And I'm just going to get this machine working.
Okay. And this will run the test. About how long does it take?
It takes about 5 minutes.
Okay.
3 to 5 minutes.
Okay. All right. Well, for more information on the Minute Clinic, go to WBTV.com. Be sure to look in the Web Extra section, which is right there on the home page. Thank you, Vera. We wanted to show that this is easy for you to get. It really was not bad at all, folks. It's just kind of like if you, with a safety pin or something, a quick,
Yes.
and it's an accident. That's kind of how it felt. So we thank you for being here tonight and for
Thanks for
also raising awareness about this because it affects so many.
Yes, it does. Happy to be here.
Okay, thank you. We will be back right after this.